Franco Cordero is a physical therapist that currently works at St. Luke's Hospital in the neuro floor, which focuses on strokes, brain injuries, and spinal injuries. Dr. Cordero earned his bachelor's in science, his doctorates in physical therapy, and his certification in stroke rehabilitation. He received these degrees in the Philippines, his home country. The starting rate of physical therapists on Dr. Cordero's floor is $40 an hour. Pay relies heavily on what region you are and what specific area of PT you are working in. So for example, if you're a home health therapist, you'll earn more than therapists that work at a hospital. When asked about the typical amount of hours he works per week, he said 40. When we asked him what his job entails during the day, Dr. Cordero said touching people's lives. Outside of his usual work, Dr. Cordero recommended volunteering at local organizations, and since he went to school in the Philippines, he did not need to complete any service hours.
When interviewing Dr. Cordero, he advised first-year students should shadow a professional in the line of work that they want to enter, to get some beforehand knowledge on how the environment works and how the daily activities will run. When asked what kind of patients Dr. Cordero deals with on a daily basis, he answered in a wide variety, but his main advice was to keep an open mind for every patient and to be able to effectively communicate with them on your plan to help them get better. When Dr. Cordero was asked what graduate students should look for in a job, he answered to not look for the highest paying job, but to instead look for the job where you can develop the most skill and knowledge in your field. He also emphasized, don't presume yourself to be the smartest person. Instead, always keep learning and developing your skills in your field. That way, you'll always be getting better as time goes on.
After meeting and interviewing Dr. Frank Cordero, I have learned that the skills needed to become a successful physical therapist is to learn patience and to learn to better understand people and to have open communication to better treat patients. Learning how to finance is also super important for the future if you're wanting to open your own business or clinic, to be in charge of the work that you do and to become your own boss. I've also learned that when dealing with difficult patients, Dr. Cordero often asks for another set of eyes and hands to help or to give the patient to a different doctor when he cannot treat them. He often volunteers with his community to gain experience and to be helpful. The most enjoyable aspect of his career is to see someone who is at their worst come back at their best, and knowing that he was able to help someone have a better life is something that he holds very highly in his career.
My name is Kyle. I have physical therapist Frank. A couple of things, starting with what kind of patients he sees. He says he sees a lot of different patients in age, varying from 16 to 106, and injuries, whether it's after New Year's, people get drunk and break some bones, or they're in a motor vehicle accident. I asked him about how many patients he sees a week. He gets a list of 10 patients to start the week, and then throughout the week, he takes care of them. And he's lucky to get through 8, so if he doesn't get to them, he passes them on. If he has patients he struggles with, he passes them on. And then I asked him about testing, and he told me that lots of testing takes place. You test in the beginning for a baseline, because a basis or a baseline is essential to determining progress. And he said that if there's enough progress, they'll test them again in the end, and that's about it. Thank you for listening.
My name is Andy, and my questions for the PT revolve around the typical workday. So my first question was how much of the job was actually hands-on practice versus just paperwork? And the answer we received was about 80% hands-on and 20% paperwork. And how that usually goes is before the visit with the patient, you'll review charts, talk to nurses, just anything you can do to gather information on the patient. And then either during or after the visit, depending on the physical therapist, they will take notes and just go from there. And my second question was about downtime and how much downtime they have from day to day. And he said it varies because there will be days where you will meet your quota and you might have downtime. But then there will be the other kind of day where you don't need that quota and you won't have that downtime you might have been looking for.